Hello, Josh. We're coming to visit your lab today. And if a patient comes in and they want to do a biopsy test and the sample comes into the lab, what are some of the steps that it goes through for the doctor to get the results?
Sure. The first step that a patient's specimen will see when they come into the lab is they'll be looking at it macroscopically or grossly,
Okay.
just with their eyes to see if there's any abnormal growth or features of the tissue. So
Right.
that's going to be performed by our pathologist assistants.
This is what we call the gross room, or it's where our pathologist assistants will work. This is where the specimens come once they've been fixed in that formalin and actually reviewed for any pathological findings at a gross macroscopic level. So the staff are looking at the tissue for any abnormalities, any weird growths, and then sectioning that for further analysis by the pathologist.
Once that process is done, then it's going to move on to the processor stage.
Okay.
That is a process where we put chemicals into the specimen to make sure that it stops breaking down.
Okay.
So we can really see fresh what it looks like when it was still in the person. It's still going to look that same way as it goes through our process.
So the tissues will come into these instruments. They're called processors, very, very cleverly named. And they will go through all these different chemical processes. It takes about 12 hours to do. And then when they come out, they're actually infiltrated with wax. And we use wax to stabilize the tissue so we can actually cut them really, really thinly.
With those really thin cuts, we're going to be putting that onto a microscope slide. And the microscope slide is going to be kind of the stabilizer so that the physician or the pathologist, that we call them in the lab, will be able to see the tissue under the microscope. We also put colors and different antibodies into the slides to help identify abnormal growth or anything unusual that might be present in the tissue. So this might be bacteria, this might be a foreign body, this might be cancer, which is really abnormal growth.
I know you have walked us through the whole entire lab process. What makes histology and cytology so different from the other areas of the lab?
I would say the biggest thing that makes them different is the specimens that we receive, we cannot receive again. Once you have surgery and that piece of tissue is removed, you can't go back and get more. It's already gone. So we have a duty to make sure that we can get all the information that we need from that tissue the first time. No mistakes.
Right. And in terms of the turnaround time and the patient results, sometimes the chemistry result, like potassium, within 20 minutes the result is available. What makes histology and cytology so challenging in terms of getting the result and the particular amount of time that it takes? What makes it so challenging for the results to come out on time?
I think it's a puzzle. And so the pathologists are ultimately trying to put all the pieces together. We've got the information from the patient, we've got the information from the surgery, information from other healthcare practitioners who are involved in the care of the patient. Once we get the specimen, we have to try and figure out and add those pieces together to build the full picture. And there are a lot of steps along the way. Something like a chemistry result, we have that one piece of blood and then it goes through that test and then the test is done. Whereas something like pathology, we have to fix the tissue. Then we have to chemically change the tissue and make sure that wax is completely infiltrated into the tissue. Surround it in wax so we can cut the tissue. And then we have to stain the tissue. Once it's stained, there's actually hundreds of different stains that we can use to help build that picture for that pathologist to understand and diagnose what type of disease that patient may or may not have.
That's amazing. Thank you for giving us this information.
So this area is very up and coming. This is our digital pathology area. So we have two scanners. We're working with a company in southwestern Ontario called Huron Digital. And so once these slides that are made come through the department, we put them on these machines and digitize them so they can be reviewed on a computer screen as opposed to on a microscope.
Wow. So How long have we had this technology, or when do we try envision this going live?
Well, digital pathology has been around for some time. What we're trying to do now is integrate it with our processes in the hospital. And innovative technologies like this do require a lot of infrastructure, a lot of storage, a lot of information technology support. So it is sometimes a little bit of a slow process, but we're committed to doing it. I think it's very exciting and new, and it's really awesome that we get to work with local talent. And I envision in the next few years this is going to be the way that pathology is really going in all hospitals.